Wagwan, welcome back to my channel. If you're new here, I'm Amilas and I do nursing videos, vlogs, challenges, videos like these, etc. And if you've been here from day one, Wagwan people, big up yourself. Now I just want to say thank you guys so much for all the love from my last video. Now this video, as you can see by the title, I'll be talking about my second or your second practicum, or what second practicum is. Now I know that it might be late because a lot of you guys are already out, but as a YouTuber that gives you nursing content, I still have to put it out for future subscribers or for my year ones who are so dear to me, who will be going into second year very soon. So let's get into the video. So you guys already know what practicum is, what it entails and all of that. If you're watching this, that means you've already went through practicum 1, or you're just curious and want to watch my video. So I'm not gonna go through the whole what practicum is and all of that. So what to expect, I'll be telling you my experience, some tips, and you know, things to expect in second year practicum, things that you maybe don't know and things that you know. I hope that this video will give you some form of assertiveness, help to build your confidence and so on. So just let's get into the video. Alright, so you know that the hours are longer for second year practicum. I don't remember, but I know it's longer. I know that the virus will be affecting some of you guys from going out, and you guys will be divided into groups. I don't know how that's gonna work, but because I know some of you guys have hours outstanding from last year, but just I'm praying. So in terms of objectives for a year 2, even though some of you guys have not done all of these skills, but for year 2 students, I am imploring you guys to add this. The list will be in the description box, maybe an hour after upload, but I implore you guys to add it. Even if it's something that you haven't done, write it as observed. So I have a book in front of me. So for a second year, the things that I think, or I believe are things that I had, was NG tube insertion and NG tube feeding. Some of you guys may not have done it before in class, but if you have a nurse that is willing to help, at first, you know, you put observe and NG tube insertion for maybe a week, and then the second week, you know, you put it as administer or insert an NG tube and stuff like that. And NG tube feeding also is something that for second year should definitely know. So add that to your list of objectives. Medication administration, this will be on your examination, so might as well, that should definitely be on your objective for a second year. Be specific with the type of medication you want. I don't think you guys are allowed to do IV or IM, but you know, administer medication, in bracket you can put subcutaneous or PO, which is by mouth, stuff like that. Suctioning, I don't think you guys are allowed to. I was in third year, I'm not allowed to do that, but I always put observe so I know how it is done, right, and so on. Aseptic dressing, so a lot of you guys said that you didn't do it, or you maybe have done it once, or you don't start doing it yet, yada. As I said before, put it as observe and aseptic dressing, because the truth is we don't know how far this virus is going or how long it's going to be here. So as much practice you can get, if a second year, you get it from now, because third year is no joke. It's no joke, and if you don't know how to do dressing, then you just can't happen. So even if you don't get it perfectly, and it's not in your examination at all, but you know, get the practice. And I want to stop right now and just apologize. I'm still in the country, so I'm apologizing for my rooster. My power be carried in my past. I'm live outside. Now, going back to the medication administration, in my time when we went out, we were not taught to do subcutaneous injection or stuff like that, because when we were supposed to do it, it was the time that the virus came and school cut, and basically did it online. we were furious. We were furious that we're supposed to do that, and we're saying that we can't do it, we can't. We've been to do it, and you can do it too, right? At first, you ensure that whenever you're going to do that, you let the nurse know that it's my first time. I want to watch a few times, and just chat along back on one of them, and they will assist you. But you will get it. You will get it. Head to toe assessment. Now this is a must, because in second year you are expected to write in docket. Now, not big people now. Got it. So in a big people now, I write in a docket and all them something. So in order to write in a docket, you'll have to do your own assessments, you know, right? Nervous? Bria? Bad one? Nervous? Don't worry guys, I'm gonna go through it. Fluid balance, right? So this entails learn how to write up the fluids balance sheet, and you can ask to see what that is. And in terms of collecting fluid from the patient, so whether it's through suctioning, whether it's through the urine bag or so on. If there's a patient like that, that's an objective that you definitely need to get done in second year. Those are just a few stuff. Oh, remember, you know, for those who are watching this who didn't learn how to put up an IV drip or IV bag, this is the time to nail it. This is the time to nail it. So add all of those to your objectives list. Now, in terms of expectation or what is expected of you for a second year student as Mr. Undergraduate, not big people know, so you'll be expected to have a patient or two. I don't know what your requirements are. In second year I was only allowed to have one, but on some days when you're depend one very disgusting word as me always depend them, I was expected. Sometimes I got like 2 patients in second year. So yeah, be prepared. You know, we already said emergency trolley. You check the emergency trolley. If you're coming from a first video, you know that that's a must. That's a must. Emergency trolley. Student want to depend on what, check emergency trolley. But how it is different for you second year, you guys are just coming out of pharmacology. I know it was online. I mean, was someone who SWAT like myself, and that is, if you did that, that was a big mistake. That was a big mistake. But yeah, we move on. I have a PDF, a file, a little document some of you might have, in which I follow when I'm writing in docket. It kind of have a little step by step, so I am more than willing to help you guys. And what I will do also is to screenshot it, put it on my Instagram in my little story, and you can always feel free to check it out. But for those who prefer it email so they can print it, do not email me. I prefer DMs. It just works better for me. What's another thing that's expected is for you to hand over your patient. You need to learn how to hand over your patient. So the same way when I go at work and you see the nurse them hand over to the other set of nurse them, that's basically the same thing. And that's all I think that's expected for you guys. Let's talk about the whole hospital experience. So boom, we get up in the morning or night, beard, put on uniform, spray because we have to smell nice, yada yada yada, go work, boom. You have your objectives written up, whether at your yard, in the car, or wherever you have your objectives written up and you're ready. The nurses will be doing handover. I forgot to mention that in my first video. And you basically go with them and they'll tell you about a little short synopsis. And if you're a student, they'll probably break down some stuff with you. They give you a synopsis of the patient, amount of patient that's on the unit, who's the most critical, who behave themselves, from who never behave themselves, who almost dead or who soon dead. That's basically handover is. So just watch it, write a little notes while you're doing so, and you come back around to the nursing station and you wait for your assignment. Right? So the sister or the nurse in charge might say, okay, student nurse hall, me, you are assigned to patient in cubicle A, bed 1. I know that's nerve-wracking, but it's not that hard, because after that you're gonna go to the sister and say, who is the nurse in that cubicle? Nurse Harris is in that cubicle. Cool. So you know, so any questions you have, Nurse Harris. Fine, you get your patients, fine. You go back to your bag, see a little prayer.
Jesus help me, Jesus help me. The patient to share me.
Just make that up. And you get ready, you get your stethoscope, put it on, and you go out and be confident because you are badass. You got this, right? Period. And so after that, you go to the patient, you realize who the patient is. You say, good morning, what's your name? You find out the patient respond. If the patient is responsive, you say, okay, I am student nurse Hall, and that will be your student nurse for today. Not all the time you'll be able to get a hold of the docket to see what's wrong with the patient, because especially as students and you're not really familiar with them like the other nurses, you can't just go to them and start an assessment. You don't know what's wrong or what to expect, right? So during that time, during handover or whatever, you write down whatever it is you hear about a particular patient. Or so after you've been assigned, you can go back and look on the care plan and you write down whatever wrong with the patient in your book. Or if you have the opportunity to get the docket, you take the docket and you read the previous notes. You wonder what, if you're on a morning shift, you read last night's note to see what the other nurse did and so on. You skip to the docket to see the doctor's notes to see what's their plan, what's their diagnosis and stuff like that, right? And if you can, take a little picture of the care plan so you can go home and wait. You go to the patient. No, you know, so your patient have a diabetic foot. They have diabetes but they have a diabetic foot, right? You go to the patient and say, hi, it's me, student nurse again, and I'll be doing your assessment. How are you feeling today? Is there anything that you want to tell me? How was your rest last night? In terms of writing in the docket, this is where you get the information from, your assessment. So whatever you say or whatever you get from the patient, this is what is going to go in the docket. In writing the docket, I think we use the SOAP-PEER method, so subjective, objective, and yada yada yada. So whatever the patient says to you or tells you, that's what you should write first. So when you go to the patient, patient verbalize, hi nurse, good morning, I'm doing all right, I'm fine, not so bad. If you ask the patient like, so why are you here again? Why are you here in the hospital? And the patient say, I stepped on a nail and I didn't know whatever. That will be in your subjective data as well. I'm not going to go too in-depth in it because I don't consider myself as bright. I think I'm smart or smart enough to get a grasp of some things, but in terms of teaching, I don't think I don't want anybody to hold me liable, so I don't really want to go too in-depth. So I'm just going to touch on things briefly, and that's a disclaimer. If I miss out anything, don't come for me, go study a book, period. So you get your subjective data from the patients and so on, and then you do your assessment. I know in school there's a little book, health assessment book, that teach you how to do attitude assessment in a particular order, but when you're on ward, you can't necessarily jump from head to abdomen, back up to back, lungs, and then something there. So we just do it based on an anatomical order, if that makes sense. So after you get the whole technicalities out the way, you ensure that you provide privacy. You pull the screen and yada yada yada. You say, okay, I'm student nurse All. I will be doing your assessment today. Please note that everything that I said to you will be confidential. Don't leave out any part there. And start with the head. So I'm going to touch you. This assessment requires me to touch you physically. Is that okay? And the person give you permission. You're not touching people then without not saying nothing to them, right? Right, so you start with the head and you start. What you're feeling for in the head? What you mean by pound like when you can't answer? You feel if anything swell, or if the patient have any pain or things like that. You move down to the eyes. So you get your light. And in my case, I never have no light, so I use my phone light. And shine, look if the pupils, whatever. Right, then I check the ears. Nothing now come out of it. If it's a elderly man, you might see ear. You know what that as well. The nose, you look if them have NG tube, even though you're gonna see it, but if they have NG tube, make sure you know what it. If not, you ask them for stuff like that. Then the mouth, and you move down to the neck. Then you start listening, and while you listen for long feel, just go to the heart as well. Back if them can sit up and stuff like that. Belly, yada 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 yada. You don't know the process. No, I got this question a lot. Do you look at a person's private part all the time? No, you are supposed to do a full head to toe assessment. But if you see if you look upon the person that can say this is a young 20-year-old boy and he just have DM foot and stuff like that, you gotta pull on him pants and look and check. Now, any lecturers out there, I know I'm not supposed to be telling them this, but this is what the nurses are going to tell you. You don't necessarily have to. You can if you want. I share my experience all the time. I didn't look once and I almost wrote that the person's genitals was fine and the person's actually didn't have any genital. It was cut off. So just to be on the safe side, go ahead and book. You don't have to do a full. Anyways, I can just ask if everything is okay there. Now when you reach down to the foot or anywhere where there's a wound, now this is very important. Description of the wound is very important. Now for this case, I said that this person is a person with DM foot, so you check the dressing to see that it's not soiled, or maybe you go and doctor just pull you up. So you have to know that to say it's soiled and it needs to be replaced and stuff like that. So after that, you know, you go ahead and do your vitals, or you can do your vital signs before. You write down your stuff, you get all the information for your patient, and you go and make your jottings in your book until you're ready to write. Now for second year, you're not gonna just write into the docket first. You're gonna write first and show it to a nurse and they approve it, and then you write in the docket. I think that every one of them will do that, but it's better that way, especially when you're just starting out. Now after you gather your assessments, you know, care plans people, care plans, that's what come next. So after you assess your patient, right, you realize that you get all the information. As a nurse, your plan is to sit down and formulate a diagnosis. What is wrong with my patient? What is the top priority for my patient today? How can I help my patient? How can I help them to be better today? Right? So not because them have diabetes, maybe diabetes is not the priority. Suppose I go to the patient and say, boy, nurse, now I kill myself today. Then diabetes cannot be priority, darling. So you get a gist of what I'm saying. Now, my teacher had sent me a document a long time ago, and I only found it in third year. And I can send it to your email as well, or you can just take notes. I can't really see it, so I'm just going to read it. It's called a disorder concept map, and this helps with care plans. So let me explain how. On this paper, you have a line. It says name of condition, right? Risk factors, clinical manifestation, potential complications. A box that also asks for the definition or the disease process or the pathophys. You have a little box that says medical management, and you have a box that says nursing diagnosis and intervention. Now it's a map, so it's kind of have a little order, you know. Right. Now if you do this, I guarantee you, if you use this or just write down things like this for every patient that you've attended to, or every patient on the care plan, as I said, take the picture of the care plan and go and go do it. If you do this, then by the time you reach third year, if you hear one patient have diabetes, you know the diagnosis. Right? Now let's go through it. Let's go through this. Now, for example, name of condition. Let's just stick to diabetes since we are there, right? That's all right. Diabetes. Boom. Diabetes. What are some risk factors for diabetes? Genetics, obesity, your diet, lack of exercise and stuff like that. You just write it down. Clinical manifestation. So you realize that alright, that patient blood glucose high. So that is a clinical manifestation. High sugar. Clinical manifestation is signs and symptoms. You realize that this patient always a call for bedpan. So with a term the polyuria. You realize that this patient always thirsty, always hungry. Those are signs and symptoms of diabetes. So in terms of, so the next box, so the next arrow, the map is directly going to bring you to your nursing diagnosis, you know. So stay with me. It says complications. So for a patient with diabetes, what kind of complication they can have? If you fill out this too, there's a part on your objective that requires you to do patient education. You can use this form to just read off to educate the patient. Alright, so continue. What are some complications someone with diabetes can have? You know, if you're a woman pregnant, you can have pregnancy complication. You know, diabetes affect the kidney, affects the eyes, arms, and right. So moving on to the disease process, pathophysiology, and all that. What is diabetes? That's what you should ask yourself. You know, you get a patient with diabetes, they sit here and say, what the hell are diabetes? What the hell are sugar? What is it? No, this is basically a disease or in which sugar level high. That's basically what it is. High blood glucose, high sugar in the blood. No, what is glucose? Because as me say, high glucose is in the blood. What is glucose? Glucose is where you get from food to get energy and stuff like that. So we need it. It's important. So why is so high? Why in your blood? Why is so high? So as some reason all things, by the way. So me ask myself, what the hell are glucose? What the hell are diabetes? And me say diabetes are when you have high blood glucose. So me say, then what the hell are high glucose? What the hell are glucose and why so high? Glucose are what you need for you get energy and get it from food. Then me ask myself, why the hell is so high? Right? Now, insulin helps glucose to be absorbed in your cells so your body can move it. See how me move my hand? The glucose do this, you know? Insulin, make me use my glucose do this, you know? Insulin. So, why is a patient a insulin now make it glucose going to the cell? Now, that's where you have type 1 and type 2. In this case, we're going to start with just type 1. So with the type 1, this is a person who don't have no insulin. So they might eat and the glucose just stay in the blood. It can't go in the cell. And that's as simple as it is in terms of, right, disease process. Now I reach to you now. Your nursing diagnosis and your nursing management. You realize, so the patient is diabetic. You take the sugar this morning and they're way up in one place. What the first thing? After me just explain all of that, if you tell us say, if person have no insulin, so the person glucose high, what you think you're going to do? You're going, naturally you're going to say, alright, give the person insulin, but alright, let's not jump the gun. You need a nursing diagnosis first. Now, I employ you guys second year, work with another book. You're not going to just know them off of your head. I know me don't know all of them and me not think me gonna know all of them. But because third year was very dreadful, I was on a 15 weeks. Some of them still in my head. So you check the patient's docket and you realize that this morning the glucose was skyrocket. Last night it was low and then one other time it was high again. So you realize that the glucose unstable. So a diagnosis that you can use for someone with diabetes is unstable blood glucose. That's all? Or risk for unstable blood glucose. Right, I think we not have to get into that. That's your homework. I'm not going to teach care plan because I can't. So yeah, you come up with your diagnosis. So you're gonna say, what you're gonna do? You know, so the patient at risk for them glucose unstable, or whatever diagnosis you come up with. What you're gonna do about it? You're gonna you can say monitor the patient's blood glucose, so you ensure that how you're gonna know if it's high or if it's low or if it'll get better. So you have to put that in your intervention. You sit the patient, you test it, and you see what's what. Because what if you just go ahead and give the patient the insulin and the person's blood glucose was low? What's gonna happen? So another one would be to administer insulin as prescribed. So whatever the doctor prescribed, you check it and you go ahead. That's all in your intervention. And what else? Yeah, you educate the patient, because you have some people.
When you go, you see them eat bun and cheese, patty, KFC, Sakura, this food from the pantry, and the whole works. So education is very vital for a patient with diabetes, because some of them just stubborn.
That's basically it. After you write that, after you write your assessment from the morning, head to 2 assessment, you include your vital signs, you write your nursing diagnosis and all the interventions that you come up with or that I've just discussed. And then after that, it's time for you to do what you write on your care plan. So if you write, say you're going to educate the patient, or if you know say you're not going to educate the patient, don't write it, because that's not an effective care plan. Or so they say. Okay, let's just jump into your exam. Now for your exam, you're gonna get 1 patient. For me, lucky enough, because due to the virus, I went to school and I did my exam. For my exam, it was for me to do my assessment, write my notes, and come up with my care plan, which includes my nursing diagnosis and my interventions and medication. When I went at school, I think it was the first years who were the patient for us. I begged with Uno because Uno never reached out to me and tell me. I'm a little nervous. But yeah. When I went, the little girl was just bawling out for pain. She just bawling for pain. So say when the patient is bawling for pain, you can ask how would you rate the pain and all them like still is the question. And my girl said 9 out of 10. So you don't know that my diagnosis was acute pain, right? So after I do my assessment, they watch me do the assessment. But after that, I did the whole medicating stuff. And my patient was on omeprazole. And basically, when you're doing medication, when you're on the ward, as a matter of fact, if you have a drug guide, fine, that's cool. I didn't have it because I don't really like things on my phone. I like physical things, hard copy. So what I do is, this is fugitive. Every time I give medication or say a nurse give medication, I ask for the paper that's on the inside. I have like a collection of these. I ask for it and I collect it for myself and put it down and study it. This way I know the name of the drug, the other name of the drug, I know the onset, when it start work, we know when it stopped work, when it's most effective, we know the side effects, because all of that you need when you do medication. So I'm not going to go into medication administration because you guys are scholars, but if you want me to do that, just comment down below and I will. So that was it for my exam, after which they bring you into a room by yourself and basically ask you some questions. I got a few questions relating to my care plan, as in why I chose certain intervention and why do I think my patient is having this pain. So they ask you questions like the pathophysiology of certain disease, and they will let you know like what to study. I think they gave us like 5 things and we just have to study it all. For those of you guys who will be doing insulin in medication administration, a lot of my teammates, classmates who got that was a bit challenging, because as I say, we never get the whole subcutaneous injection practice, but it's not just administering the drug is the problem. Insulin is a bit more complicated. You have to know if it's long acting, short acting, and a bag of stuff. So any questions or anything that you have or anything that you are scared of, you get it done on the ward first before exam. Make use of the opportunity you have, guys, because you don't know if you're going to be pulled from the ward and so on. and that covers everything. So as me say, a tip, you know, you don't know if you're going to do exam on the ward, you don't necessarily know who your patient is going to be. So a tip is to get a picture of the care plan and you go home, and if you say diabetes, you write down diabetes and you Google nursing diagnosis for diabetes. If you have a patient with breathing problem, nursing diagnosis for patient, and if you do that, you're good. That's what I do, you know. Right, so that's it for all of that, but there's something that I really want to discuss with you guys. If you're watching this, if you're a student, if you're a lecturer, if you're a clinical instructor, whatever you are, man, woman, boy or girl, this is something I want to say. It's something that has been on my heart. Right, ice cream choke. Me I try to stay serious, but legit, the hours that we are expected to complete is coming from nursing council. Nursing council tell it to the school and the school send we out. That's basically it. Yeah. Now there is a certain protocol when you, in terms of absence, you know, you can't, when I say that, I mean you can't just come, don't show. You have to follow a certain protocol. There are certain rules and guidelines that you have to follow, and yada yada yada. I personally think that it is not practical, and it does not include, in that bracket of rules, it does not include persons who are lesser fortunate. And let me just explain. It is saying that if you have to be absent, or if you are absent for 3 days, you know, you have to get a sick leave, or rules are there and you can't fight it, fine. But how practical is it for every time you're sick? I mean, you can't plan sickness. Every time you're sick, you have to go to a doctor and get this and come back. What if you go to the doctor today, spend 4,500 and you're sick again? That's another 4,500. So it's not practical. And this is why it is so important for me to tell you this, because I am coming off a practicum where I was on ward for 15 weeks, every day, back to back. Nursing students do not get paid. You have to find your way to some far places, find your food, bus fare, uniform, because you can't go with apron shots. You have to make over that if you gain like a quarantine weight. You can't go without your hat. You have to get a hat, apron, stocking, shoes, stethoscope, all them something there, fine. And I was at a point onward where the pressure got to me so much that I did not feel like myself. Like, I felt that I would just pack up my bag and left and just done with nursing school. And in nursing school, they teach you about mental health. They teach you about giving care to a patient who has certain characteristics like that you have. But when it comes to you, you're not allowed to feel that type of way. Or if you feel that type of way, you are expected to work through it because you're a nursing student. But you're a human being. I've been on a ward where I felt so sick in myself mentally. Yes, I could show up physically because I'm not in no physical pain. But I don't think that they pay attention to mental, you know, awareness much, even though they teach it, even though they send us out on mental wards, right? So I just want to put that out there, and I'm saying that to say, if there's any time you're on ward and you feel like you'll lose yourself, it's not worth it. Take your days. I'm not telling you to break the rules or whatever. But if you make up the days after, or I don't know how you're gonna do it, me not encourage nobody for do nothing. But you are more important. Just do what you're doing respectfully, but it's not worth it. So watch, I may have one prop. You see, when you drop a ground, see you earlier, this is the world. You see, when you drop a ground and dead, you think your world are gonna stop? They're gonna have a moment of silence at school, maybe 10 seconds or a minute, and then after which practicum continues. You dead and buried under the ground and gone, and so everybody else there get their degree. It's not worth it. Do not lose yourself in the process. Do not lose yourself in the process. Put yourself first. boom. So anyways, I'm just happy that you guys are out and getting the experience. Any questions you have, feel free to reach out to me and I'll see what I can do. All the best, and thank you guys so much for watching. Don't forget to like, share, comment and subscribe.